So, hi everyone. Today's unit is communication skills for health and social care. And today is the assignment session, so it's the final session, and my name is Shazia Khan. So before I go on to doing the assignment session, I want to summarize each learning outcome with you. So the first one we'll go through it's quite quickly, so because these have already been done. So I'll just give you a summary of each one. So the first one we've gone through is learning outcome 1, which it was to know how health and social care organisations communicate. We looked at the unit aim, which was to develop knowledge and understanding of communication in health and social care organisations and to develop personal communication skills. We also went on to look at the principles of effective communication, why communication is so important, and the issues around effective communication. We looked at the principles of effective communication. We looked at different models of communication. So we looked at business communication model and how it goes from the sender to the receiver and then feedback. Then we went on to look at different models of communication in regards to Aristotle's model, Laswell's model, Warren Weaver's model, Screm's model, Riley's model, Berlow's model, and contemporary model. And we looked at what each model focuses on, which I'm not going to go through because you've got it all on the slides there in regards to what each model went through and what was the importance of each model. Riley's model, Screm's model, contemporary model. And then we looked at 1.2, which we looked at describing communication models and systems used in the health and social care organisations. And why do you think when we look at health and social care organisations, why do you think communication is so important? Jewel, why do you think communication is so important?
Because it helps in different ways.
Sorry?
Because it helps in different ways.
Yeah. It's a two-way process, isn't it, between people listening and, understanding your views as well.
Yeah.
We then went on to look at theory of communication. So we looked at humanistic theory, cognitive theory, social theory, behavioral, sorry?
No, sorry.
Behavioral theory and psychoanalytical theory. We then, in learning outcome 1, went on to 1.3, which was looking at the benefits of both informal and formal communication within the health and social care setting, things like verbal communication skills, non-verbal communication skills, your facial expression, your eye contact, things like that. We looked at that in regards to learning outcome 1. Then verbal communication. So what is verbal communication? And how people in the health and social care use verbal communication we looked at. We went on to non-verbal communication, which is body language, so your person's behaviour, the way you portray your message, your facial expressions. Then we looked at forms of non-verbal communication, so touching, gestures, eye contact, signs and symbols, and we looked at the importance of this. For example, things like if people could not hear, or they need signs, people cannot see, they need signs in braille. Technological aids, things like hearing aids and video phones, and we looked at technology in the form of mobile phones and text messages. We also looked at social media as well, which is quite a technological aid as well. We looked at human aids, interpreters, translators, people that are signers as well. Alternative forms of communication, people with visual impairments, Braille, British Sign Language, Makaton. We then looked at some signs just there. 1.4, we looked at how technology is used for different types of communication. So technological aids such as electronic communicators, hearing aids and video phones, and what they're designed to help disabled people who have difficulty sending or receiving messages as part of the communication cycle. We then went on to look at the barriers to communication and looked at the importance of these barriers in regards to the factors that affect communication. We then went on to look at foreign language and cultural differences, why that plays a big impact. and the dialect in regards to different sorts of dialect. We looked at jargon, slang, and use of acronyms, health issues, environmental issues, and then we looked at 1M1, which was to propose solutions to barriers to effective communication in health and social care settings. So things like, cultural barriers, replacing the environment, replacing the lights, fitting electronic devices. And then we looked at care workers can make the best of care environment by making sure they have clearly by the person they are communicating with, understand language needs, so special interest works on behalf of group who have sensory impairments or disabilities. Care workers should understand the language needs and communication preferences. We looked at the pace and the electronic devices such as loop, why it's their ways of overcoming barriers. So it's their induction loop helps deaf people. We then looked at 1D1, which was to evaluate how different uses of technology can enhance or detract from good communication in health and social care settings. And that's the use of technology, social media, email, webinars, presentations. And then that was learning outcome 1. Okay, so we'll go on to learning outcome 2 now, okay? So you've got a better idea of what we've been doing. Learning outcome.
Okay.
Just 1 minute. I'll just share this with just. Learning outcome 2 with you. Can you see that, Jewel? Jewel, can you see this? Yeah, this is learning outcome 2.
Yeah, I can see.
Yeah, okay. So this is the second one. So we've done learning outcome 1, and learning outcome 2 follows on from learning outcome 1, and it is looking at being able to interact orally with individuals in a health and social care setting. We looked at firstly what communication is and why it's so important, and that it's not just about what you say verbally, but also what you say through the actions. Your body language shows how you express yourself and how you're feeling. And people in the health and social care setting need to work with relatives and visitors, and also different practitioners and care agencies from a variety of different sources, so that it could show your body language. What could it give out? What kind of messages can your body language give out, Jewel?
My body language gives
Yeah.
loves and to convey the following happy.
Could you give out the fact that you might be happy?
Yeah.
Be scared?
Yeah, scared, pain,
Yeah.
frightening.
Yeah,
Like,
so your body language could give lots of messages to different peoples. There may be a message where you don't like someone, and your body language can portray that.
yeah.
So then we looked at 2.1, which was to use different styles and methods of oral communication to meet the needs of different individuals and different types of communication. So practitioners working in health care, social care, and early years settings need to be able to communicate in different ways with individuals and other, including their colleagues, other professionals they work with, and individuals, families, and advocates. And there are 4 types of communication skill that practitioners must be able to understand and use: verbal, non-verbal, written, and specialist. So we've got verbal skills, and we've talked about verbal skills Practitioners who feel confident in their own abilities would tend to speak more clearly and more positively than practitioners who don't. You know, people that are confident speak more clearly than others. Then we've got 2.2, which is to demonstrate appropriate listening skills. So effective communication in care settings helps both care workers and people who use care services to form good relationships and to work well together. People communicate most effectively when they feel relaxed, are able to empathize with other person, and experience warmth and genuineness in their relationship. The Solar model of communication. So the Solar model of communication was developed by Gerard Egan and based on approaches used in counselling. And the model of communication shows how active listening can be demonstrated to others. So how you sit, how you position yourself, how you lean forward, you know, it shows that you are listening to the person. You know, this model helps in the health and social care profession when you are listening to people and you're feeling relaxed as well. And then we looked at why active listening is important. It's because you pay attention and the other person knows that you are communicating with them. Listening and attending. And by far the most important thing in the health and social care profession is everyone needs to be listened to. So if we can listen to someone, we can help them. You know, you as an individual, if you listen to someone's concerns or listen to anything about a patient, you know, they're able to identify that you are listening, and they are, you know, happy that you are listening and you are, you know, listening to what they're saying and supporting them. Aspects of listening. So we've got linguistic aspects of speech, it refers to the actual words and phrases used. Paralinguistics, non-verbal aspects of communication, which is body language and facial expression. And then we've got behavioral aspects, sit squarely, maintain a position, like I said, lean forward and feel relaxed. Blocks to effective listening, so health professionals' own problems they might have. They may health professionals stress and anxiety. They may feel you do not have enough time for them, you know, lack of attention. Value judgments, aids to effective listening. So it might be that, you know, there's no sensible use of prompts and things. 2M1, use appropriate methods, including technology and other aids to present information orally. So communication aids. Technology has established an increasing number of electronic and digital aids to communicate that can help who have difficulty speaking. And these are devices that are available for people who have difficulty speaking orally or any sort of technological aids that are available. 2D1, manage and facilitate a question and answer session to demonstrate subject knowledge and assess effectiveness of your own oral skills. So this was a question and answer session that you could look at. It was an example for you to look at when you're doing your assessment part. Then the references what we use for today's session in Learning Outcome 2. Then we've gone on to the next one, which is this 1 minute. Learning Outcome, that's 1, 2, and Learning Outcome 3, which is the last one. So can you see this, Jewel? Yeah? This is the last learning outcome. So from that followed on from the different types of models of theory, models of communication, verb types of communication, verbal, non-verbal, technological aid, human aids. We've gone on to looking at the different types of humanistic approaches. We went on to look at what active listening is in health and social care, and now Learning Outcome 3, which is to able to communicate information in writing, which is really important in regards to how you communicate information to people in the different forms of writing. So we looked at what written communication is. So health services need to keep good written records of the care given to patients, clients, for 3 reasons. Firstly, to make sure the care and treatment can continue to be given safely, no matter which staff are on duty, 24 hours a day, 7 days a week, to record the care that has been given to the patient, client, and to make sure there's an accurate record of evidence when there's a complaint from a patient. So, you know, if you don't write anything down, it's very hard that if a patient wants to make a complaint, that they'll be able to identify, that you've got the documents as evidence in place. So we looked at the principles of written communication, and that you should write as possible as the time you delivered the care. So straight away, write simply and clearly, write legibly if handwritten, and as an error-free as possible if keyed into the computer. Insert dates and times as accurately as possible when specific events and circumstances occurred. Avoid giving personal opinions. Avoid writing anything judgmental. 3.1. Explain the uses of different forms of written communication in health care setting. So written communication forms an important part of working with individuals in health, social care and early years settings. Practitioners may be asked, for example, to write a care plan or to a daily report about the care provided to an individual, or the instructions to follow for a medical procedure or activity they may need to take, minutes of a meeting, or to email an individual's family. Health services need to keep good written records of the care given to patients for 3 reasons: to make sure that the care and treatment, to record the care, and to make sure there's an accurate record. Principles of written communication are: you should, by the ex-Royal College of Nursing, what we mentioned earlier, write simply, clearly, write legibly, insert dates, avoid giving personal opinions, avoid anything judgmental. Good writing skills create good impressions. How the text is presented, including the typeface and font size used, a clear and easy to read layout will be more professional. Correct grammar, punctuation, and spelling. This will instill confidence in the reader. The style of writing used, formal or informal, may be required for certain situations. So, it may be a situation where you've got to be professional, so that will be informal writing. The language used, which is the use of correct language and correct terminology, and the jargon used is ensuring that information you've said is actually understood. Specialist communication. Practitioners working in health and social care early years have different interactions with individuals. How diverse range of needs, the knowledge of specialist communication, how to use these may at times be required to effective interaction. So Braille is used by visually impaired or blind people, and now that are unable to access any sort of materials. So they will use Braille to help them, support them, and identify if there's any issues around that, so that they could read what they are, what they are wanting to read. And the way Braille is presented is through, raised dots and the alphabet. And then we've got sign language, and the one that's used in the UK is the British Sign Language, BSL. It's recognised by the UK government as an official language, and it's people that have got hearing impairments. So 3.2, communicate information using appropriate written styles and methods. Here you need to make use of one of the written styles and methods, so letters, email, formal report, a patient record, informal report, a prescription. 3M1, use appropriate technology and supporting graphs, diagrams, or any artwork to support written communication. Here you need to make the use of one of the software to enhance communication using images, graphs, and tables. Use of tables, graphs, and images to show a patient record, for example, an ECG or an MRI scan or an X-ray report. 3D1, evaluate examples of different forms of actual written communication found in the health and social care setting. Here you need to use the enhanced communication methods like completing patient records, writing for different audiences, individuals, for example, and their families. Record keeping. Why do you think it's so important, Jewel, to have, keep a record of everything you do? Why do you think it's so important?
Because
Jewel?
when we keep the record,
Yeah.
It will keep the patient's client journey through the service.
Yes. Yeah, and obviously keeping a record is, to have the patient's journey through, any sort of services or the continuity of the patient client. If there's any things that, the next person has to come on, and we need to make sure that the records are clear, accurate, and timely, and so that we understand them. Different means of record keeping are used in health and social care settings. Some places use handwritten records, others have moved to computer-based systems, and many use a combination of both. You'll be expected to comply whatever requirements your employee sets for you for record keeping. That means that you'll need to know how to use the information systems and tools in the workplace. Protect and do not share with any other one any passwords, smart cards, and make sure your written records are not left in public places because of GDPR and, data protection. And these are the references for learning outcome 3. Okay, so we've done now learning outcome 1, learning outcome 2, and learning outcome 3, a summary of it, because we went through them before individually each week. So now what we're going to be looking at is the assignment area. Okay, so let me just get the assignment question up. And then what I'll show you, show you a sample of the assignment stuff as well, okay? Sample assignment. So this is the assignment for this communication skills for health and social care. So you have 2 weeks to do this assignment after everything the unit has finished, okay? You need to follow the requirements of, making sure that you put your name on the front of the assignment cover with the unit name, and each time you do a task, make sure you put that as a heading, okay? And you need to be using Harvard system for referencing. So the related qualifications, ATHE, level 3 diploma in health and social care. So this is the assignment. So you are going for an interview. In the documentation received with details of the interview time and location, there's an additional document which refers to communication skills. It states that an essential skill that you need for working in the health and social care sector is the ability to communicate clearly. Make sure that your messages are the same one that is received. This includes written and oral communication. And it states that good communication within our sector helps effective working relationship with staff and clients. At your interview, you will be asked to provide the following: a short presentation that demonstrates your knowledge of how people and organizations communicate within the health and social care setting. Further evidence that is task 1. Task 2, further evidence that you're able to communicate orally in a competent manner. Task 2, evidence that you're able to communicate competently in writing. Task 3. Note that evidence of these tasks can be collected as you work through your program of study. So we'll go on to task 1, okay? Task 1, are you able to understand that? Yes?
Yeah.
Task 1, you need to plan and deliver a formal presentation to senior managers that demonstrate that you understand the models and systems of communications used in health and social care setting. If you are successful in this interview, you need to help our employees apply best practice. So we looked at the models of communication, Riley's, Screms. You need to be looking at that, and you need to look at systems of communication as well, humanistic, things like that. Okay, so that was learning outcome 1. So see below for details. So for the communication 1, models and systems using a description of communication models. For example, message between sender and receiver and the communication systems used in the health and social care setting. The systems are a range of processes used to communicate with different stakeholders. So is there an effective communication system in place? Number 2, communication methods and technology in health and social care. A description of methods used by health and social care professionals. And I think that this is learning, this is task 2. So, okay. So the extension activity now, if you want to gain a merit, okay, this is if you want to, you know, for your presentation, get a better mark, you must also look at proposing solutions to the barriers you covered in section 3. You must also look at using appropriate presentation methods, including technology and other aids to represent business information orally to the audience identified. Now, to gain a distinction, you must invite your audience to ask questions and demonstrate your knowledge through a question and answer session at the end of your presentation. You must produce a handout to accompany the presentation, which has an evaluation of different uses of technology and how they can enhance or detract from good communication in different health and social care settings. You must also assess your own communication skills and set targets for improvements. And that is learning outcome AC 1.1, 1.2, 1.3, 1.4, learning outcome AC 2.1, 2.2 and 1M1, 2M1, 1D1 and 2D1. And this is all, task 1 is all in learning outcome 1 and 2, okay? Task 2. Can you hear that? We're on task 2 now, yeah?
Yeah.
Throughout your interview and your presentation, you will be assessed on your communication skills, and the interview panel will want to know how you communicate with different people. You are asked to role play a response to a distressed next of kin who has not received the promised information about their relative. Give your response orally to the interviewing panel. So that will be an oral communication with an interviewing panel, and it will be a role play where, you know, someone's quite upset, and it's like, you know, a session of you talking to the person and them talking back to you, okay? And that's learning outcome 2, which is AC 2.1 and 2.2. Then task 3, communicating in writing. At the interview, all job applicants need to complete written tasks, but you are also able to present information completed prior to the interview. Submit at least 3 of the following. So it could be a formal report, a letter, or your CV, or emails, web pages, leaflets that you have produced. Your evidence should demonstrate that you are able to communicate information using appropriate styles and methods. Extension activity. To gain a merit here, you must also use appropriate technology and supporting graphs, diagrams, or artwork to support written communication. To gain a distinction grade, you must also evaluate examples of different forms of written communication found in health and social care. And that's LO 3, AC 3.1 and 3.2, 3M1 and 3D1. And this is the criteria, the guidelines for the assessor that they must follow, okay? I just want to go back to showing you a couple of the examples. So have you got any questions on the assignment? So you've got 3 tasks, Jewel. Each task you need to do individually, and then you need to identify that you've done each of the learning outcomes, okay? So if you want to do extension activities to get a merit and distinction, you need to identify that you're doing them, okay?
Okay.
So if you do 1M1, you need to do a heading saying 1M1. So it needs to be clear. You need a contents page as well. Your name, your details on it, and your contents page. What I might just go on now is just to show you an example presentation. Sample presentation. So can you see this sample presentation here?
Yeah.
Right, someone has done this in regards to the first task, which is task 1, okay? Theory of communication. Task 1,
Excuse me.
plan and, sorry?
Can you scroll up on upwards?
This is why, this is Raman.
Yeah. What is L01 AC? I don't. What is...
That's learning outcome 1.1, 1.2, 1.3, 1.4, and this is in learning outcome 1.
Okay.
Okay, when we did it at the start, I showed you the when we did the presentations. Have a look through the presentations. Learning outcome 2.1, 2.2, 1M, 1, 2M1, 1D1, and 2D1. And these are the extension activities, 1M1, 2M1, 1D1, and 2D1. Now, if you want to get the distinction or merit, okay? So task 1, you need to plan and deliver a formal presentation to senior managers that demonstrate the understanding, the models of communication used in health and social care organizations. If you are successful, you need to apply, our employees apply best practice. A description of the model. So this is an example for you, okay? So you could look at that model where we looked at the message between the sender and the receiver and the communication used in health and social care. This is the communication model. Then we looked at other various models. So you've got things like, you know, a healthy communication is a two-way process in which the person who listens tries to understand and the other point of view. A good communication involves the process of active listening and checking understanding. In the health and social care setting, a good communication is really required between the customer and the staff. The staff should have good communication skills in order to develop a good relation with the customer. There are many theories of communication. Out of Abraham Maslow's theory applied to health and social care, it includes contemporary theory. Remember, we looked at the contemporary theory? We looked at the communicator encoding message, medium, receiver decoding, then Aristotle's model of communication. And this is all for task 1, okay, Jewel? So the speaker, the speech, the occasion, audience, and the effect. Then we looked at communication systems used in the health and social care settings. So we've got things like display systems, monitors, TV or equipment, check-in terminal, EPACs, telephone system, prescription generating system, and the hearing in loop. So these are used in health and social care settings. So you've got the RFID card, thermometers, beside patient terminal monitors, medical point of care information computer, healthcare digital signage displays, surgical displays, and monitor solutions. Task 2. Okay, so that was all to do with task 1. Any questions on task 1?
No, it's okay.
Okay, task 2 now, okay? Oral communication, learning outcome 2, 2.1, 2.2. Here you have a distressed next of kin who has not received the promised information about their relatives. The scan of the bowel have confirmed the growth of cancerous tissue. And here it will be a question and answer session. So the question will be the tutor and the answer will be you. Okay, so you will be going through with a next of kin who's upset about the scan that they've got, the next of kin has received that their family member has cancer. Okay, so this is an oral communication with a tutor. So you will be doing this as task 2. Task 3, you need to produce evidence. So like we said, you need to produce evidence which could be a CV. So that will be your CV, yes? Evidence 2 could be a formal letter. And evidence 3 could be an email. Evidence 4 could be a flyer. And these are task 3, okay? And then the references are just down here. So this is if you are, this will help you towards doing task 1, 2, and 3. Okay, and it gives you a guideline. This will all be on Moodle for you. Is there any questions around these slides?
No, ma'am. No, ma'am.
This is giving you guidance and support around doing, you know, the assignment and covering learning outcome 1, 2, and 3, and also covering task 1, 2, and 3. Okay, so this is guidance for you to help you with that. Have you got any questions around that? I'm just going to see if I can get... Okay, there's some examples here that I've got that I can show you. And these are things for learning outcome 3, okay? So this is a sample CV Can you see that? Have you got a CV, Jewel? Just 1 minute, Jewel. Sorry about that, Jewel. So this is a CV. Can you see that? Jewel, can you see the CV?
Yeah, I can see.
This is task 3, okay? So these are just examples that you can use, and they're on Moodle for you. This is another one which we've put in the slides as well, a letter asking for information. So you could do this. You have to do 3 sorts of documents. So this is a letter asking for information that you could use. Another one could be, let me just get the other ones. Just 1 minute. Another one is a letter writing, letter of complaint that you could do. And then you've got another example that I've got is letter to make a booking. You know, if you need to make a booking for an appointment or anything, that is another one. And this is learning outcome 3. So you've got to do 3 different types of letters, okay? So one could be your CV. I think personally, if you do CV and an email and then choose another one, that could help you in regards to that. And then this is like question skills. Just, can you see this? This is like question skills. You know, like question session, why to ask questions, how to ask questions, what type of questions. And these are all on Moodle for you. These are just samples for you that you could look at. They're all on Moodle for you to have a look at. Sample task for theory 1, we've done that, yeah. Seven C's. And here we've got a why it's a. I don't think you can see that. Just 1 minute. It's an article, and it's all these resources are on Moodle for you. And this is an article by Clinical Practice, and it's about communication in the health and social care, a narrative review and of the literature and practical recommendations. So you could look at this article and have a read around it and identify some issues around, you know, anything happening, why communication is so important within the health and social care, and what their inefficiencies are in written communication and the efficiency. So it looks at both the background and the barriers to communication. And it identifies also things like, you know, the different types of models, strengths and limitations of having written communication, recommendations. It looks at medical records, why it's so important to have good communication within the health and social care sector. And going back to the assignment session, let's just go back to the going back to this assignment session here, assignment. Are you okay with doing this now? It's 2 weeks after. So make sure you use Harvard referencing system for referencing. Make sure you title everything, and make sure that you also have a contents page where everything is, and make sure you're clear. If you're doing task 1, put task 1 as the heading. Okay, and then if you're doing the extension activities, put each extension activities. So if you're doing learning outcome AC 1.1, 1.2, 1.3, 1.4, and then AC 2.1, 2.2, put that as a heading. And then if you're doing the extension activities, which is the first one, is AM1, put that as a heading, okay, and that would be looking at proposing solutions to barriers, okay, and then 2M1 is to use appropriate methods using technology, and then 1D1 is to invite the audience on the question answer session, and then 2D1 is to produce the handout. So make sure it's clear that you're doing everything in order. Then if you go on to task 2, make sure you're clear that you're doing a task 2 separately, and then task 3, communicating in writing. And, you know, you could produce a letter, your CV, emails. Have you got any ideas what you're going to produce for task 3, Jewel? Hello, Jewel. Have you got any ideas what you're going to produce for task 3?
Task 3?
Yeah, so you've got to submit 3 documents. So a letter, a CV, emails, leaflets. What have you thought of any that you can do? No?
Yeah, I just got an idea.
Yeah.
We have to write the heading and all.
Yeah. Have a look at that, and then when you want to do any extension activity, you need to make sure it's clear that you've done the extension activities and you've highlighted that you've done them, like 3M1 and 3D1 separately, okay, to the pass criteria.
Okay.
Okay, have you got any questions before we finish this session off? The guidelines are there as well. It helps you identify what is needed for, it's mainly for the assessor, but it gives you the guidelines there, what is needed for it, okay?
No,
And this is all
I
on
am good.
Moodle for you.
No, I am good. You are a nice teacher.
Sorry?
I got all doubts clear. You are a nice teacher. Thank you.
Oh, thank you, Jewel. You're lovely as well. Just make sure if you need any issue, if you need any support or anything, you need to go to the learner work, email address. Are you able to access Moodle and everything?
Yeah, I just got an idea. Ma'am, can you give me your number? If I got
I think it's on the learner works.
Okay.
You can get it on Moodle. I think my number will be on there. But just email me if you need to email me any issues or anything. Just email me and I'll get back to you about any of them. But, you've got 2 weeks from today, because the sessions are finishing today. So you've got 2 weeks from today to get on with doing the work. So you've got task 1, task 2, task 3, and also the exam sample ones are on Moodle. So make sure you're on Moodle. Can you get onto Moodle? Can you get onto Moodle, Jewel? Yeah?
Yeah. Students module,
Excellent.
right?
Sorry?
Students module?
Moodle, students Moodle, yeah.
There's your number, right?
Yeah, I think my email address is there, yeah. You can contact me on email.
Yeah, ma'am.
Okay.
Thank you, ma'am. Thank you, ma'am.
And have you got any questions around the assignment, Jewel?
No, ma'am, it's okay now. You
then.
said nicely.
Okay, then. So if you've got no questions, thank you for attending today's session, and thank you for your patience, and good luck with doing your assignment. And if you have any question, just contact learnerwork@ukvarsity.org. Okay, that's the email address.
Okay, ma'am.
Thank you. Thanks for attending today's session.
Thank you, ma'am. See you.
Bye.
Have a nice day.
You too. Bye.
Ma'am, can I leave?
Yes, you can. Thank you.
Thank you, ma'am.